Welcome. Today's topic is ciliary ganglion. So, in the brain, we have the three parts, that is the midbrain, pons, and medulla. So, coming to the midbrain, here there is a nucleus called as the Edinger-Westphal nucleus. Edinger-Westphal nucleus. Okay. Here, the oculomotor nerve, that is the third cranial nerve, which supplies to the different kind of extraocular muscles of the eye. Here we will read the extraocular muscles. You have learned it, that is there are two types of muscles, that is involuntary and voluntary. Okay, we are not going to that in detail. So first, coming to it, the oculomotor nerve beginning from the midbrain passes from the supraorbital fissure. It will pass from the supraorbital fissure and then from the cavernous sinus. Here one cavernous sinus is also passes from the cavernous sinus before passing from the supraorbital fissure. It passes from the cavernous sinus. After that it get divided, means when it will cross the supraorbital fissure, it will get divided into the two branches, that is the upper and the lower branch. Upper branch will again divide into the two parts, and the first part will supply the levator palpebra superioris and the second will supply the superior rectus. The next lower branch will supply the inferior oblique, inferior rectus and medial rectus. These are the muscles to which the lower part of the oculomotor nerve supply. Now coming to the pons, here the nasociliary nerve, which is the sensory root, okay, here it is the sensory root, nasociliary nerve. It passes on and supplies the sensory innervations of the eye. These are called like cornea, eyelids, conjunctiva, and many more other sensory types. Again, now this green part which you are seeing here from the Edinger-Westphal nucleus, what I have said in the earlier, Edinger-Westphal nucleus. From there a nerve emerges and it travels along with that of the oculomotor nerve. It passes again then the cavernous sinus. Here cavernous sinus is made, but I have not made it. So the Edinger-Westphal nucleus nerve emerges, passes the cavernous sinus and then the supraorbital fissure, then again goes on to the ciliary ganglion. Here it relays with another postganglionic fiber and it then supplies the eye. Here it divides into the two branches and supplies the number one sphincter papillae and the number two is the ciliary muscle. First it supplies the sphincter papillae and the second it supplies the ciliary muscles. Coming to the last, medulla. So not from medulla directly, where here what we are seeing is that the internal carotid artery plexus, there is one internal carotid artery plexus which covers the sympathetic plexus, also called the sympathetic plexus. Okay, from here a nerve arises. Okay, sympathetic plexus, from here a nerve arises and it gets to the eye through ciliary ganglion. Okay, and what does it supply? It supplies to the dilator pupillae, and this nerve is called the short ciliary nerve. This one is the long ciliary nerve and this one is the short ciliary nerve. So it supplies the dilator pupillae. So if we sum up the ciliary ganglion, there are three parts: parasympathetic, which this Edinger-Westphal nucleus, this green nerve coming from the midbrain. This one is the parasympathetic nerve. Okay, I'm writing it down. This one is the parasympathetic. Okay, this one is the parasympathetic. This one is the sensory. Here I have written it also, sensory root. And this green nerve which courses towards it, this one is the sympathetic plexus. Okay, because it is coming from the internal carotid artery, which is the sympathetic plexus. So this will cover the sympathetic part, this will cover the sensory part, and this will cover the parasympathetic part. So these three comprise of the ciliary ganglion, and it supplies to the eye, which again supplies to the sphincter papillae, ciliary muscles, short ciliary nerve, which supplies to the dilator pupillae, and this the nasociliary nerve, which supplies to the like sensory innervations, cornea, eyelid, conjunctiva, and all these things. So hope you guys like the video. Thank you.